Hi everyone, I'd like to speak to you today about JFil, which is a new Rocamed stent. It's a stent that has no bladder loop, 12-month indwelling time, 7 French by 16 centimeters long, and it comes with a lockable pusher in the kit. The benefit of that is for placement, as there's no loop and the shortness of it, so that you can place it from kidney 3/4 of the way down the ureter. As you can see on the picture itself, the sutures will be in the bladder itself, the trigo area. The stent will be in the kidney and 3/4 of the way down. The benefit of that is no irritation. Most patients' irritation happens in the bladder, and because of this, they won't have that irritation, which is great, especially for patients on a long waiting list or continually complaining. To place the device is very easy. It's your bog standard guide wire placement. Then you would take your stent itself with a pusher. It locks into position very easily, as you can see there. Logs into position. The surgeon then will place a guide wire down the tip of this stent itself and introduce it. Like all other cases, once the stent is in position, the guide wire will come out of the back of the pusher. The clinician then, all he does is he turns the lure lock anti-clockwise, and then he pulls the introducing part. And there, as you saw, it just releases the stent. Very easy to release. The stent will then remain inside the kidney. The sutures in the bladder. It's designed in a tapering effect, so like a sperm cell. Reason being is because if you have a clean cut flange, you'll have discomfort on the ureter and redness and tearing into the ureter. So this is the design that has worked, and we're very happy with the design and the results. We've worked with a Dr. Vott, and over 3,500 patients this type of procedure has been performed on. To remove it, very easy. These sutures are as thin as hair in the bladder. When it comes to time of removal, you just go into the bladder, you grab the suture and you pull, and it will release the stent, extract the stent out of the patient, and it's time for an exchange. So I do hope this is something that may have interested you, especially at this time where many patients are on a long waiting list and you don't want to have those calls of patient discomfort. Please give Rocamed a call, give it a go, give it a try. You can get hold of your local representative, or you can contact Rocamed direct, and do visit our website at www.rocamed.com.